Hi, everyone. It is a pleasure to record this class for you, although it's a little bit sad for me that it is our last class together. So I hope we have an opportunity to meet again in the future after the exam. But for now, we're going to talk about future directions for nursing, and in particular, where nursing theory leads us around future directions for our profession. Yikes. I'm out. My computer sometimes freezes and it looks like I am, oops, frozen. So here we go. Understanding what is advanced practice nursing. When we talk in other situations, not in relation to nursing theory, when we talk in the world about advanced practice nursing or advanced nursing practice, we can flip that either way. We use it in both ways. We often mean a clinical nurse specialist, an RNEC or a nurse practitioner, a special clinical practice leader, or an educator in a clinical setting. And even the Canadian Nurses Association, CNA, defines advanced nursing practice to involve 4 different specialized areas of competency. So that might be clinical competency at an advanced level, research competency at an advanced level, leadership competency at an advanced level, or various levels of consultation and collaboration that happen, and to enact that at an advanced level. In Ontario, we have a special designation, a special kind of registration for an advanced practice nurse called a nurse practitioner. And in Ontario, under the College of Nurses, there are 3 categories of nurses. There's an RN, registered nurse, RPN, registered practical nurse, and there's also the RNEC, registered nurse extended class, and that's a nurse practitioner. In Ontario, there's various routes by which you can become a nurse practitioner. You can focus on primary health care, which is sort of first contact care. Primary health care nurse practitioner would work in a doctor's office or a clinic, medical clinic, where you'd have your own patient load. You might work in an emergency department, but typically not with the acutely ill patients and other places. So primary health care is much more holistic in its focus. And there's a consortium of 9 universities in Ontario that offer a primary healthcare nurse practitioner certificate. It happens most often in a master's degree, but it can also happen as part of a graduate diploma. There's also mechanisms to obtain graduate preparation in acute care nurse practitioner, either in adult or pediatric foci. And there's new and emerging roles for nurses in advanced practice. So for example, a nurse anesthetist or a nurse first assist. But here's another opinion. Do you remember we talked about Jackie Fawcett? She was the person who first did all that research as part of her PhD that looked at what are the main areas that we always talk about in nursing research and nursing practice, when she looked at journal articles for the last 100 years and textbooks and what we taught in nursing programs, and when we talked about nursing at conferences, what did we talk about? And through that work, identified those 4 meta-paradigm concepts. So Jackie Fawcett worked to identify what are the meta-paradigm concepts, and those were nursing, person, environment, health. Well, she's also weighed in on what is an advanced what is advanced nursing practice, or what is an advanced practice nurse. And what she says is the problem is when we talk about those categories of advanced practice that I just mentioned, we're talking about medical practice. That what we're calling an advanced nurse is someone who's moving more and more towards medical practice. So you're enabled through registration, regulations, or through policy to enact practice that has more and more relation to medical practice. So you become more independent. You're able to order. So for example, a nurse practitioner can order x-rays. She can order medications. She can make a medical diagnosis. Other kinds of things that a registered nurse or a registered practical nurse can't do. Jackie Fawcett says that we're really making a mistake here, that when what we're calling advanced nursing practice is far removed from nursing, because nursing is about the application of nursing theory. And do you remember this course is all about nursing theory? So this is about the application of nursing theory. So what we're calling advanced nursing has nothing to do with nursing at all. Those advances have nothing to do with nursing at all. So what Jackie Fawcett says is, if we really pay attention to what is advanced nursing, it is the application of nursing theory. So those theories that we've been talking about throughout this course to the patient situation. And she highlights that when she talks about this change that's happened in practice over the last 15 years or so, where we have come to accept evidence-based practice as the norm. And of course we should. There should be evidence to all of the decisions that we're making in relation to patients' medical care. And that is an epidemiological focus. We look to the evidence, and the evidence is based on research and patient experience, patient perceptions, practitioner experience, other kinds of things as well. But when we talk about evidence-based nursing practice, what constitutes the evidence? And that's a really key question. What is the evidence in evidence-based nursing practice? When we're talking about patient outcomes related to congestive heart failure, that's medical evidence. When we're talking about patient outcomes through the application of the Roy adaptation model for patients experiencing congestive heart failure, that is evidence-based nursing practice. And so the application of nursing theory in the construction of nursing evidence is critical, according to Jackie Fawcett and many other theoreticians, people who focus in the area of nursing theory. And so for all of you, the bottom line here is that the world sees advanced practice one way. It's very commonly understood to be the evolution of your clinical practice or your leadership skills or your research practice in such a way that you are moving to much higher levels of independence. But within the healthcare system, higher levels of independence typically mean higher levels of medical freedom. So advanced nursing practice in the way we understand it commonly in the world, and even in the way the Canadian Nurses Association defines it, is typically a move towards much more paramedical practice, as opposed to what Jackie Fawcett and other theoreticians would say is advanced practice nursing, and that's the advanced application of nursing theory to research in clinical situations. I'm going to talk about another thing now, and this is really important. This is an idea that I think is relevant, excuse me, not only to this course and understanding how we sort of learn about new things and change because of it, change our minds, change our beliefs, our perceptions, but also how over the course of your career you change and are changed by what you experience. And so it's important to recognize the difference between learning new information, gaining knowledge, and being changed, changing your ideas. And those are two quite different processes. So when you learn something in pathophysiology, you learn new information, and that knowledge is important. But when we learn something in nursing theory that is philosophical or theoretical, or in our practice experiences as we come to know and experience human beings in a wide variety of situations, often what we're going through is what's called perspective transformation. And I'm going to talk about the steps in the next slide, but just important to understand that perspective transformation is a learning process, just as we learn new facts. We might memorize something, we might come to know it in different ways. But in perspective transformation, these new facts, this learning process, leads to a change in our perspective, in the assumptions that underlie what we believe, and in our values and beliefs themselves. And this perspective transformation leads to changes that are fundamental to who we are in the world. So it leads to changes in the way we see ourselves. It leads to changes in how we situate ourselves within our profession, who we see ourselves as a nurse, for example, and also the world of nursing. And finally, it leads to changes in how we see ourselves in relation to other people and our relationships with them. So perspective transformation is really important because it really uncovers our values, our beliefs, our ideas about how the world works and what matters to us and our perspective on things. And it is inevitable that these change over the course of our lifetime. So some things are very static, and we believe them, and we carry through with those beliefs, and many other things in our lives and in our perspectives change over time with new exposure. And it's important that we just recognize that it's a process that takes place. It takes place with exposure to new ideas and new experiences. And it's not always an easy process. It can feel a little bit unsettling. And to recognize that that's normal and that's a human experience. So these are the stages that are part of this perspective transformation. And so we start off in a place of stability. Just we have our values and our beliefs. We have our own perspective about something. And it could be anything. It could be a variety of things. Let's say I have a belief. My perspective is that the world is a good place, and as long as you treat people well, people will treat you well, and it's essentially a safe place to live in. And we grow up feeling that. We learn that in our homes. Let's say we have that belief. And then we come to be exposed to some events or ideas, and there starts to be what's called dissonance, a sort of a disconnect between what my own perspective, what my values, my beliefs, my assumptions, and what I'm experiencing, what I'm seeing, what I'm learning. And that dissonance is a little bit unsettling. So, for example, I start to see things on the news about bad things happening to people, or I might experience something myself that's difficult. And it seems to be disconnected from what I believed about the world being a good world. And as long as you're good, then other people will treat you well. But wait a second, that's not what happened to me. So how do I make sense of that? And so this dissonance leads to a real sense of inner confusion. And going through this sort of phase where you really are uncertain about what you believe to be the truth. Now, the perspective transformation doesn't happen when we can prove something to be right or wrong. Perspective transformation is about our view on something, our belief and our value on something. And so it requires that we collect ideas and collect thoughts and collect experiences. And we actually live in this place of uncertainty, of not knowing. Perspective transformation doesn't necessarily happen in a moment. Sometimes the point at which we change our minds happens in a flash, but typically that's because we've had a period of time where we are dwelling with that uncertainty, and we're collecting observations and experiences, and we're mulling them over. So we're living through that uncertainty, and sometimes that can feel, again, uncomfortable, as we're really trying to make sense of what do I believe? What is my perspective on something? And as we collect this data, sometimes that data, the new information, the new experiences can have a large impact. Sometimes they can have a small impact, but we get to a point where nothing new is happening. Regardless of what more I see, what more I experience, I'm not changing my mind any further. I'm at the point of saturation. And think of a sponge. When a sponge is full of water, it's saturated. It can't absorb any more water. And that's the point where it's saturated. No new perspective change happens, regardless of what I see. And so at that point of saturation, we experience what's called synthesis. So all of my thoughts, my feelings, my beliefs about whatever the phenomena is, synthesize into a new idea. And with this synthesis, with this creation of my new idea, my new perspective, I have resolution of that conflict. I no longer feel the confusion or the dissonance. There is resolution to that, and I reconceptualize what I believe. I reconceptualize my perspective on something. And so, for example, and then we return to a place where we're stable. So, for example, let's say we're going back to my example of I believe the world is a good place, and people are innately good, and as long as you treat other people well, they will treat you well. And I start to experience things where I believe I'm living by those values, and yet bad things are happening to me, and maybe the world isn't a good place, and should I be nervous? And I start to dwell in that uncertainty. And either I may have some experiences where my original belief is validated. I see that those experiences I had that were unpleasant are actually anomalous, and I come to a place of resolution where I reaffirm my original belief. Or maybe I have more experiences where I really believe that I can't be so simplistic in my view, that the world is just a good place, and as long as you're a good person, nothing bad will happen to you. If you treat people well, they will treat you well. Maybe I come to believe that not everybody is innately good, although the world is still a good place, and I treat people well, but I can't always assume that they will treat me well, so it's important to bring a little caution. Maybe I come to a middle ground perspective. And with that reconceptualization, I return to stability. Or maybe I throw out my old views entirely, and I have enough experiences that tell me you can't assume that the world is a good place, and you can't assume that if you treat people well, they will treat you well, but I will still choose to behave in a certain way. There's a variety of mechanisms. I guess that's my point here. I can move along this path in a variety of ways because it is my own perspective, and it's the experiences that I have and how I ponder them and how I process them that brings me to a point where no new experience is changing my perspective on something. I resolve the internal conflict I have, and I reconceptualize whatever my original stance was, and I become stable again with that new perspective. But this is an iterative process, and that means that we return through this over and over again, many times experiencing it. So coming back to Fawcett, Fawcett identifies the 5 key areas that we need to move on in terms of our development as a profession. For nursing in a theory-guided approach to be successful, there are 5 key areas that we need to focus on. The first one is a pretty obvious one. It's that we need to understand how nursing theory-based practice is essentially a mechanism by which we communicate the scope of nursing practice. And it's so important because that enhances our understanding of the role of nurses in healthcare. So how does theory-based practice communicate what nurses do in practice? Secondly, she says it's important that we understand and ensure that the methods for documenting nursing practice reflect nursing's unique knowledge base. If you'll notice that typically the documentation methods in healthcare settings are designed around a medical model of care. And so it's very rare that you would see mechanisms by which nursing theory guides nursing documentation. And yet if nursing theory is not guiding nursing documentation, nursing theory becomes an add-on. So for her, the second area for important development is making sure that our documentation systems reflect a nursing theory approach. The third area is really important in terms of moving research forward. There are certain elements of research that are starting to be identified as nurse-sensitive patient outcomes. So recognizing what patient outcomes are specifically associated with nursing care. And we've begun to accumulate a list of those, one where we have evidence that shows nursing care relates specifically to patient outcomes. And so an example of that might be falls. Patient falls is an area that's well-defined. Continuing to work in such an area that nursing care becomes the focus of the research, and the patient outcomes related to nursing care that is driven by nursing theory in particular is an area to focus on. Fawcett also says we should focus on both the nurse's experience and the patient's experience of providing care using a nursing theoretical approach. So the nurse's experience of what it's like to provide nursing care, and the nurse's satisfaction in providing nursing care using a nursing theory, and the patient's experience of receiving care when the nurse is using a nursing theoretical approach. And then finally, application of nursing models and nursing theories across a wide range of settings. And that's what we're seeing a lot in our mid-range theories. So that application of nursing theories to a very specific patient population and looking at the experiences of people in receiving care and the potential outcomes of care. And then I'm going to talk about the second big focus of this lecture today, which is Benner's approach to understanding not how we nurse, but how we become nurses. And this really focuses on a theory that was developed starting in the 1980s and continues to be as fresh today as it was back then. And many of you will experience orientation programs when you are employed as RNs in your first RN jobs. Or for RPNs, you may have already experienced that in your employment, because orientation programs that are well developed in the use of Benner's model. It is highly adopted in clinical settings, in educational settings, and is pretty much internationally acclaimed for its applicability in really developing an understanding of the progression of nurses throughout their careers, and in particular, their increasing level of competence and the mechanisms and structures that are necessary as they move through that process. So here's the first stage, and this is where all of you guys would be at. You're a complete beginner, you're a novice. So you don't have any experience, and sometimes they say if you don't have experience in a specialty area, you go back to being a novice. Let's say you're a more experienced nurse in a surgical unit and you go to work in a cardiology medical unit, you'd go back to being a novice. Typically, I'm just going to say that's a little bit erroneous. Once you develop some level of expertise, you would rarely go back to being a novice. You would probably go back to what I'm going to talk about as the next stage, the advanced beginner stage. In any case, a novice really has very little knowledge to draw upon and no experience in the area that you're in. And as a novice, the way you make sense of the practice world is that you follow the rules. So you develop and you try to really uncover what are the rules for being successful for nursing in a certain area. And you don't try to understand how you would apply those rules in different situations and what does the context call for, but rather apply the rules of nursing as if they were context-free and in a really kind of inflexible way. So you're not differentiating from one patient to another. You are following the rules. You're following a structure. You're getting your vital signs done right away. You're making sure your medications are on time. You're making sure your treatments are done on time. And you're not as adept yet in the novice situation. So think of yourself, as a nursing student, not as adept at picking out what are the relevant features in a situation versus the non-relevant ones. What information is most important or what information is least important in a situation. This is not a failure or a critique of a novice nurse. This is inevitable. Nursing knowledge is so big. It is so huge. It takes time to develop this depth of understanding of what pieces of information, and there may be hundreds or thousands of pieces of information in any nurse-patient exchange. And it's so important that it takes time to be able to filter very quickly that information, almost to the point where it's imperceptible that you're filtering that information, that you're filtering information out. And I think of that example of when you first learn to drive. And when you're first learning to drive, how you're focusing on making sure the car is staying between the lines on the road and you're looking right in front of the car. By the time you're an experienced driver, you don't even remember where you've driven, how you drove yourself home, or staying, you wouldn't think that you have to focus on staying in between those lines. It's the same way for nursing. In the beginning, you're focusing very specifically on the rules and how to make that work. The next stage is an advanced beginner stage, and that's sort of like where you would find yourself typically as you graduate from your program and begin your first job as an RN. And it's kind of a transition stage for you. So you're able to function in an acceptable way and meet the standards and the competencies, and that's really important, but you tend still to be quite task-oriented, focused on getting the job done, the things that need to be done when they are supposed to be. And you look to others or external standards to determine if you are providing good nursing care. So are you doing a good job because others think you're good? Are you doing a good job because you're getting things done on time and in the way that they're ordered? And do others value, as opposed to any inner sense of yourself? So it's really looking to make sure you're accomplishing what needs to be accomplished based on someone else's plan of care or a medical pathway or something else, as opposed to any internal sense of your own in terms around nursing care. It takes a couple of years. It takes some time to really settle into nursing. And so with the next stage, the confidence stage, we don't see until about between 1.5 and 2.5 years out in practice. So imagine 2 years. Give yourself a good 2 years before you have settled into yourself as an RN. And it's so important that you don't try to rush that. There is no getting there until you get there. So in those 2 years, you've begun to accumulate so much information, so much knowledge, that you'll be able to bring together various bits and pieces of information as patterns. And you start to see the patterns, the relationship between a variety of things, the relationship between heart rate and blood pressure and respiratory rate, the relationship between seeing a patient in a certain condition post-op and seeing a patient condition then later deteriorating, or a patient's condition stabilizing. You're beginning to see those patterns and put them together. Sometimes you are very conscious of that process, and sometimes that pattern recognition is very intuitive and is not so conscious, but becomes part of your toolbox, this pattern recognition capacity that nurses have. You begin to realize that there's an unlimited number of plans of action. In any given situation, there's a million different things you could do, and it's your job to determine what is the best course of action. And your shift finally, is that you can stop worrying about what other people want from you and what other people think of you, and you can internalize that sense of what is important. And so you're focusing much more on the patient and the patient condition than on trying to determine if you're doing a good job. So there's not much less focus on self-performance and much more focus on the patient. And it's not that before this you were selfish or just cared about yourself. It's that you were always appraising yourself. Am I good enough? Am I good enough? Do I have it? Am I safe? Am I competent? Am I successful? You can let all that go at the confidence stage. Now, that goes without saying, you're focusing entirely on your patient. And that's a relief to get that stuff out of your head. More years pass, and it takes time to become what's called the proficient nurse. And you move from competent, where you're able to focus on the patient and recognize there are many options in a situation, to proficient, in which you are much more focused on relational skills and on your ability to see the gray in any situation, not just black or white, but see the many shades of gray in any kind of situation. Much less focused, again, on what the rules are, and much more focused on the specifics of the situation, the context, the individuals, the nuances of the situation, and gaining enough information to be able to make good decisions or even recognize that other people might need to be involved. Much more use of intuition, which often is really that application of what you've come to develop as that pattern recognition skill, and a much greater focus on sort of the big picture of things instead of the little picture and the rules, much more understanding of what is the larger goal, what needs to be accomplished. The little things can fall away. You can give on the little things as opposed to being so rigid. No need to be self-appraising all the time, much less focus on yourself and your own performance, much more focus on patient outcomes. Just doing what's right for the patient and recognizing when you have the capacity and recognizing when you need help to make that happen. And in this proficient stage as well, much stronger communication and negotiation skills. And it's important to recognize this, why it might be easier for a senior nurse to do some of the advocacy and some of the leadership demands involved in the role of the RN versus a young graduate nurse. And why, it's important, I think, for me to point out that we can be so hard on ourselves thinking that we can do it all because we tell you that all nurses need to be patient advocates. Sometimes we forget to say, but it's really, really hard. And it can be hard. It can be hard as a human being. It can be hard to make a tough call, to try to agonize over whether you should or shouldn't be doing something, how to speak up for someone in situations where the person you're in communication with doesn't want to hear what you have to say, lots of things. As we move through our careers and we have so many exchanges, so many interactions with people, we really develop those communication and negotiation skills in such a way that they're very refined, and nurses are known as some of the best communicators in healthcare. And then finally, the expert stage. And it's really wondrous to be with a nurse who is an expert. And often what we would characterize an expert nurse is someone who possesses what's called vigilant monitoring. So that ability to really watch your patient, pay attention to your patient all the time, and to really ascertain if there are any changes, if there's anything amiss, if there's anything you should be watching for. And we often know that that nurses and BSCN educated nurses have a huge impact in preventing issues with patients as opposed to just responding to issues. And that's part of this whole process of this vigilant monitoring. We also begin to be aware of changes to our patient condition that doesn't require us to be sort of assessing very specifically. We pick up so much information, coming back to that idea of pattern recognition. We are almost like a sponge, and we pick up so much information all at once that we, without any conscious effort, we're able to determine there's a change happening. And finally, this really important issue of moral agency. We are able to more easily act on what's right without feeling any pressure around it. It's just simple. It becomes quite simple and straightforward. We're very confident in the face of changing conditions and rapidly deteriorating patient situations, when the system isn't working well, when there's conflict and other kinds of things. We're much more able to respond to them effectively and confidently because we have so much experience and so much exposure, and we are so much more solidly in our own shoes. So why is it important that we know about Benner's stages? I think for me, one of the big walk-away messages from Benner's stage is that it's important not to be too hard on yourself, that it's hard to become a nurse, and it takes time, and there's no shortcut. It just takes time. So while you can learn as much as you can learn, and it's so important to learn as much as you can learn, it also just takes time to develop those skills. And it takes growth, and that personal and professional development is a wondrous thing to experience, but it comes with some hard knocks. So be patient with yourself, be forgiving of yourself, recognize you're going to make mistakes, Do your very, very best, but also don't apologize for seeking help and for knowing that you don't know everything, and that this is a journey. And like every journey, you're going to have some ups and downs along the way. And we're just about wrapping up, but just to point out, Benner says that we go through this process, this progression from novice to expert, and within our role as a nurse, we enact 7 different we provide 7 different types of services, and by enacting these 7 different roles. So the first is a helping role. We're there always to help. We are the helpers within the healthcare system. We also take part in teaching and coaching. So supporting our clients through a variety of mechanisms. It might be health teaching, or coaching. We're involved in diagnosis and patient monitoring elements. So we don't make or communicate a medical diagnosis, but we are involved in practices or procedures that are part of a diagnostic workup. So for example, we might take an EKG. I might read an EKG. I wouldn't communicate that reading to my patient, but I would seek some help should I be noting something on that EKG that is abnormal. And all other kinds of patient monitoring functions. I also am required to intervene with rapidly changing situations. So if the patient's condition is deteriorating, it's critical that I'm able to intervene and take appropriate steps to be able to provide support to that client that's going to hopefully positively impact their health condition. At the same time, I'm responsible for administering and monitoring the various therapeutic regimens. So starting IVs, running IVs, giving medications, all of those kinds of things. I'm responsible for those therapeutic interventions. So for knowing how to do them and why to do them and when to do them and when not to do them, all of those things. A 6th role for nurses is monitoring and ensuring the quality of healthcare practices so that we're meeting the healthcare practices we're involved in are meeting the best standards of practice. And that involves not only myself on an individual role, so am I following best practices around whether or not I would catheterize patients, because we know that the #1 cause of patient-acquired UTI in hospitals, HAUTI, hospital-acquired UTI, is catheterization. So catheterization should be a procedure of last resort. Not only a #6 would I be involved in monitoring and ensuring the quality of that healthcare practice, but I would make sure that my organization is well aware of that and that's part of the best practices that we're involved in as an organization. So you move beyond just the individual practice to affect workplace practices and even competencies that go beyond individual work organizations to nursing competencies at a regulatory level or at an organizational level. And that's it. It was short and sweet, and I look forward to seeing you all on Friday for the exam. And I'm going to wrap it up by saying it was a pleasure. It was a real pleasure to teach all of you. And I just so look forward to seeing you in the future and seeing as you move along in your educational path and then into your practice. So see you all on Friday. Bye.